In today's health headlines, at this point in the pandemic, you've probably had COVID and don't even realize it. What you need to know about monkeypox, now a global emergency. And with the first case of polio found in the United States in about a decade, will boosters be needed? Joining us now is Dr. Scott Roberts, Yale Medicine Infectious Diseases doctor and assistant professor at Yale School of Medicine. Doctor, welcome back.
Thank you for having me.
Great to have you. So has everyone had COVID at this point, even if they don't realize it?
That's a good question. Several studies are now showing that many more people have had COVID than we initially thought. And the reason for this is we can actually test the blood and check if any antibodies have seen COVID and the body recognizes the COVID virus. And that number is estimated to be as high as 60% as of February. So it's very likely that many people have had COVID and haven't realized it, either because of mild symptoms that they didn't think anything of it, or they were asymptomatic. And up to 40% of cases can be asymptomatic.
All right, doctor, let's talk about monkeypox. It's been declared a global health emergency by the WHO. What does this mean and what precautions should we take?
Yeah, I think this really reflects the fact that we're seeing increasing caseloads really all over. We in Connecticut, I believe we're up to 19 as of today. So this is continuing to rise, and really this declaration reflects that we need to devote more resources and funding toward combating this epidemic. So certainly things are getting worse. That said, I think this is a disease that is much less transmissible than COVID. Currently, it's restricted mostly to the men who have sex with men community, but we saw 2 cases in children over the weekend in another state. So certainly something to keep an eye on as we see increasing caseloads.
All right, and doctor, with a case of polio found in New York, do we need to be getting polio boosters?
Yeah, there was a polio case in an unvaccinated individual in Rockland County. I emphasize with my patients, most people have no symptoms, but about 1 in 200 do develop paralysis. This was a live vaccine virus that probably came in from a traveler who got vaccinated in another country and then gave it to a susceptible individual. Right now, the Department of Public Health is not recommending routine boosters, more so for those who are either not up to date on vaccination to get up to date as soon as possible, or boosting those who are at direct risk of being exposed to this patient.
All right, doctor, thank you very much for your time and the very latest on this Monday afternoon.
Thank you. Take care.